core strength is very important. So we're going to work on first bring our belly button to our spine. So you're going to make almost like a J type of formation, very slight. Second is you're going to almost interrupt the flow of urination. You're going to squeeze the pelvic floor. And third, you're going to slightly exhale to create a compression of the diaphragm, also increasing the tone of your transverse abdominis muscle and other obliques. So just practice squeezing these areas. You should be able to breathe. And with this, you're going to slightly lift your foot just a centimeter off the floor. And switch sides and down. Lift the left and down. Right, down. Remember, you're squeezing everything. Up and down. Very minimal movement happening at the pelvis. Switch, down, switch, down. Now, bring your legs together. I want you to squeeze your knees and your ankles together. Remember, you're squeezing your pelvic floor, your belly button, and your diaphragm. And you're reaching up, so you're clasping your hands together and reaching up. And you're imagining there's some sort of rope tied to your wrist, and it's bringing you further and further up towards the ceiling, and it's even tightening your core even more. You should still be able to breathe. And you should feel strong and sturdy. Keep squeezing everything. Pelvic floor, tight core. And slowly release your arms and now your legs. Again, we're going to do one by one. Belly button to your spine. Hold and squeeze the pelvic floor into the flow of pee, and slightly exhale to engage the diaphragm. Squeeze the legs again. Remember, you're constantly going through step 1, 2, and 3. Clasp your hands, reach your arms up to the ceiling again, and really reach up. Your spine is getting an inch longer with every exhale. Squeeze everything. Core, pelvic floor. Squeezing your knees and ankles. And reaching up further and further with every exhale. Now slowly release the arms, and now the legs. Take a little bit of a breather here before we prepare to do it again. So when we're doing this again, we're going to engage our glutes as well. So this is the motion you're going to be doing. You want to reposition and make sure that when you're pushing yourself up, see how I'm doing a couple test runs here. I'm not putting stress on my shoulders, and I'm making sure that I can just push up. So let's go through one by one. Belly button to your spine, squeeze the pelvic floor, and slightly exhale. Keep everything contracted. Hands down, squeeze the glutes to push yourself up so you're flat. So this is essentially the easy version of a plank. And what's easier than that is reverse plank, and what's even easier than that is to do it on an incline on the chair. So when you're in this position, engaging your core even more, you're constantly repeating to yourself, core, pelvic floor, squeezing glutes, core, pelvic floor, squeezing glutes. You want to make sure things are nice and strong and steady to protect your back. Now very slowly return back and rest for a moment to prepare to do it again. Breathe with the abdomen here. So when you take deep breaths, you want your belly to rise and fall. You should not be breathing with your chest like I just demonstrated. You want the majority of the breath coming from the belly. Deep breaths, continue deep breaths, about 4 seconds inhale, 4 seconds exhale. And again, the 3 core contractions, belly button to your spine, squeeze that pelvic floor, and tighten that diaphragm. Prepare your arms, squeeze your glutes, keep everything tight, and maintain a complete straight line from the base of your skull to your tailbone. And repeat to yourself, core, pelvic floor, glutes. Core, pelvic floor, glutes. It's important to keep everything contracted, but still be able to breathe. Core, pelvic floor, glutes. And slowly recover back to a seated position. Take a few moments. Take time to inhale and exhale very consciously through your diaphragm. 4 seconds in, 4 seconds out. Place your hand on your abdomen if it's easier for you to concentrate on that abdominal breathing. If this is difficult for you, take your time, and you can even lie in bed at night and work on this abdominal breathing. If you're having a difficult time, there's also a video that I have called Reduce Stress, and that would be a good place to go if you're having a difficult time with this. We really go through it in detail, and it's a very slow pace. Now again, 1, 2, 3. Belly button to your spine. Squeeze the pelvic floor. Slightly exhale to engage the diaphragm. Prepare your arms. Squeeze the glutes so much that that's what's pushing up your hips towards the ceiling. And hold that straight line from the base of your skull to your tailbone. And repeat to yourself, core, pelvic floor, glutes. Core, pelvic floor, glutes. It's common to forget about one after we begin to get tired, but it's really up to you to be diligent and constantly monitoring yourself. And slowly back again. Now just gently slide towards the edge of the chair, and you're just going to pick up your knees. So again, you're being nice and tight, belly button to your spine, squeezing the pelvic floor, slightly exhale. And you're squeezing so tight that is what is keeping your pelvis straight when you're lifting your knee up towards your chest. You want your back to stay straight. You want everything to stay tight so that you're not moving or shifting, and you're staying nice and square. So you see how my upper body is barely moving? It's because my core is so tight and engaged that I'm able to support, and my extremities and my legs are just moving, but my core is staying tight. If you're beginning to get tired and you're noticing it's more difficult for you to contract your core, pause the video and take a break like we're doing here now, because I'm about to show you a more difficult one here. So we're just using the arms, and you want, again, squeeze that core because you just want your arms moving. You don't want your body twisting as you're crossing your arms in front of you to the opposite knee. Essentially, we're going to be doing a seated bird dog. And yes, bird dog is an exercise if you haven't heard of that before. Now just inhale and exhale. 4 seconds in, 4 seconds out. This is your last break before we're doing a full-on seated bird dog. Okay, all three, belly button to your spine, squeeze the pelvic floor, slightly exhale, you should still be able to breathe, and now prepare, so reach up. When you're crossing over, you're also bringing up your knee, so they touch, and down, and switch sides, arm up, knee to your wrist, back up, and switch sides, arm up, opposite knee to opposite wrist, up and down. Tight core, pelvic floor. Tight core, pelvic floor. Squeeze. No movement within your spine. It's just the arm and the leg that's doing the movement. Tight core, pelvic floor. Just a couple more here. And one more. Right, so that is what we have for today in terms of the seated core workout. This is a very important video to do, especially if getting on the floor or doing regular core work of planks and side plank is a bit too difficult right now. This is a very good way to still protect your back and start to strengthen your back without putting too much stress. So if you know anyone in your life in the same predicament as you and this is really helping you out, please share this video with them. And if you have any suggestions for me or any requests for videos for me to release in the future, please leave them in the comments below. I'll get back to every single one of you. And also, please subscribe to my channel because you'll be one of the first to be notified of any videos that I release in the future, including and maybe one video that you have requested. Thanks for being a part of my journey, and as always, stay safe and healthy.